Your hand or your phone. We're going to make an incision right here in this crease, and that will get us access to the tendon sheath, which sits right here, and then we're just going to unzip it.
So can you hang on for one quick sec?
Yeah.
All right, so this is a trigger finger that I've suffered with for about 5 or 6 years, and right now I'm literally just trying to move my hand and the finger's stuck. So this surgery is to release this trigger finger.
Okay. There we go. Your exposure will be problematic because of my headlight.
Yeah.
Probably.
Quite a bit of lidocaine and I don't feel anything. And
Another canonic canvas on the super loose. Actually, no. Okay. And we're kind of getting down through, it's called palmar fascia. There's some pretty tight connective tissue in the palm that we're going through. It gets us access. The local anesthetic has epinephrine in it, so there's not too much bleeding. If you can see that, that's the tendon sheath right down there, the thing that sits right about there. And that's what we're going to open up. So, and then Kayla retract for me. Okay. There we go.
do you do this sometimes and people don't want to be awake, or have you ever done it when they're all the way out?
Yeah, most of the time we do this in the office. Obviously it's totally numb and you don't feel anything. Some people don't want to be, so we're going to release that tendon sheath right there. You can see, I don't know if that comes out on the video, the tendon inside looks different and the sheath is actually quite thick there. So yeah, we will occasionally take people to surgery for this by their request. My typical approach is that I do it here because it's a lot easier. So I'm just gonna...
Curious as heck on the billing then. If you have to take them into the surgery, that's going to bill probably a different
here
rate.
a little bit. So the surgical fee for me is the same, but yeah, you get all of the associated hospital charges. I don't know for trigger finger. I do know for carpal tunnel, which takes about as long. Charges are highly variable depending on insurance contracts. I have seen the hospital get paid, come up with that guy, Kayla, as much as $50,000
Wow.
for something like this.
For something like this,
Yeah.
if you have to be put under?
Yeah.
Wow.
I don't see $50,000, but the hospital does.
I'm pretty damn sure you don't.
So now we're just kind of sneaking out. I made a space on top of the tendon sheath here. And that guy runs out. And tendon there. We can see that. Let me displace you here just for 1 second so I can make sure I get up under here.
No problem.
I don't want to not get you all released for purposes of the video. Hold on. There we are.
Yeah, I would recommend that most people don't look at it unless they're capable of dealing with that in the first place, and much less on themselves. It's pretty gory looking.
So that's pretty much it. I'm going to make sure there's nothing that gets caught on this side, and then we're going to have you move it and prove that it worked.
Okay.
Inflammatory is what we call tenosynovium. It's the lining of the tendon. Okay, so come out with that, Kayla. Now I want you to bend your finger down. straighten it out. No catching.
Okay.
And so you may be able to see, let me have you do that. Sometimes you can actually see the nodule. Sometimes the nodule gets released.
Wow.
So you see that big old bump that comes down into the field right there?
Yes.
That's the thing that was getting caught. And that's inflammatory tissue. Since after it stops getting caught, it will gradually resolve itself. Actually might trim a little bit of that. Hold this guy, Kayla. Bend your finger down there a little. Get rid of some of that. Bend your finger to right there. So this is not tendon, it's tendon lining. There we go. A little blob of junk. Okay. No catching. Stitch you up and you'll be on your way.
Okie dokie. So while we're talking, if some of the things that I always found fascinating was where did you go to school, like to learn all this stuff? What school?
So I went to medical school at the University of Texas in Houston. And then I did residency, which is post-medical school training at University of Washington. That's up in Seattle. And that's a 6-year residency training program for plastic surgery and hand surgery as part of plastic surgery. So not all plastic surgeons do hand surgery, but some of us do. Actually, not all hand surgeons are plastic surgeons. Some of them are orthopedic surgeons. You can get into that from either specialty.
6 years of residency seems like a long time.
That's a pretty long time. Probably the shortest residencies, historically maybe 3 years. I think a lot of them are now at least 4. Internal medicine, family medicine, some of those things are 3-year programs. Most of the surgical fields are 5 or longer. Probably the longest is something like neurosurgery. Neurosurgeons stay in training for 8 or 9 years frequently.
Well, I know psychiatry is quite a few years too.
I think most of those are probably 4. Psychiatry, a lot of the internal medicine subspecialties, cardiology or nephrology or those ones, also end up being pretty long because you do like 3 years of general internal medicine, followed by a specialty fellowship program, which is probably 2, but maybe 3 years.
So when you were in high school, what was your plan?
To not be a doctor. My dad's a doctor.
Oh, okay.
And I don't know, it seemed like he worked really hard, and it never was just, I wasn't opposed to it. It was never not something I thought I would do. But I actually found it super duper interesting. And then I figured I was gonna, be some sort of a medicine subspecialist, and I didn't think I was gonna like surgery. And that also didn't work out very well for me. It worked out great in the long run, but once I started doing it, I can't imagine doing something else. I love doing this stuff.
Curiously, these things that a lot of people are doing now with the implants, the butt lifts and just so many things like this are just astounding to me, that people are implanting stuff in their body as a regular thing. It's do you do that sort of stuff? Or?
I don't do any butt implants. I don't do butt lifts. We do use, we do breast augmentation, and we use breast implants for breast reconstruction and that sort of stuff. Yeah, I do. The bulk of what I do is not purely aesthetic. We do mostly reconstructive things, but certainly do some aesthetic surgery as well. So it's all, in some ways, reconstructive. You're just reconstructing different things, right? So it's not stuff that's been injured. It's stuff that just doesn't feel right to the folks who want the surgery. Insurance doesn't always agree with that, but.
Did you ever have any time in the ER?
We would rotate through the ER, as residents, trauma stuff. This is some skin glue. Helps to seal that off. Makes it nice and easy to manage.
Hey, while you're talking about the glue, there's been some videos where people try to use super glue on themselves, and apparently it has a real bad effect. But what's the difference between this and some kind
It's
of...
not wholly different. It's all cyanoacrylate. The surgical glue has, I forget exactly, they talk about it's like octyl instead of something. It's more flexible. So if you ever glue yourself, you ever cut yourself, especially on the hand, and you super glue it, it'll work fine, and then it gets all cracky and flaky and it falls apart pretty quickly. And so this stuff has a little bit more flexibility to it, which makes it work a lot better.
So what was your grades in high school?
Straight A's. I was the valedictorian.
Oh, wow. That's impressive. What state did you go to school at?
I went to
High
school here in Napa.
Oh, wow. Okay,
Yeah.
local. So you came back.
Yep. Give that another minute to dry there.
You took like the advanced placement courses? Yeah. I've been a school counselor, so what do you think about the difference between taking some actual college classes versus the AP classes? Because I know that's an option for some kids.
Yeah, I don't know. I mean, I think most of it's a logistical problem, right? Like, I know that, so my daughter's in high school and they can cross enroll, but they're like, how do you actually physically leave campus and get to the college and take a course and come back and not have that, bag a huge period of time? Seems challenging.
Yeah.
Well, I think they probably...
The way I did it with my daughter is you have the concurrent enrollment, so you can do that, and you have the dual credit classes. Dual credit if they're taught on campus sometimes, but a lot of the classes now are Zoom. So she was able to get in, I think she got in 8 classes while she was in high school.
I mean, if you can get college credit for that,
Yeah, she got
save you a lot of money.
well, she got the college credit, but because it wasn't, well, some of them were dual enrollment, so then she got the high school and the college credit. But what happened is she was in California where she was in dual enrollment, and then she got to Texas and they wouldn't let her in, so I had to get a hold of the community college system, and I had to fight the high school because they had a memo of understanding with the high school, and I had to fight the administration at the high school to say, look, she's already completed 3 courses at college level.
They were claiming she didn't have high school requirements in order to go to college because she hadn't finished the high school
yeah,
classes.
they have. She's not good at math. She has a sort of a learning disorder. She cannot visualize numbers in her head. So if I say to you 5 plus 2, you organize those numbers in your head most likely. She couldn't do it.
Okay.
So she couldn't see any numbers in her head. And they said because she can't pass this math test, she can't go to college. So I had to go around that and say, look, she's already gotten three A's in college classes.
Right.
Clearly she can do it, but they wanted to say she has to pass this math course. I eventually got it's called South Texas College. I eventually got them to agree to let her take courses, but she's taken like 4 shots at algebra just to get algebra, even though she had straight A's in all of her other classes. So it was pretty hard. Here in California, it's a little easier. Anyway, that's about it. I appreciate it. So what am I looking at healing, and what should I expect?
Right. So this dressing you can take off, I give it a day or 2. So tomorrow or Friday. You can wash your hand at that point. The incision is waterproof. The glue is fine to get wet in the shower. I would not submerge it for any prolonged period of time underwater for about 2 weeks. And then, you can keep a Band-Aid over the incision if you like, or you can just leave the glue exposed. The glue is fine and all that you need. If you're doing anything that, is dirty or anything like that, I'd keep it covered. Do what you feel up to. One of the risks that we see with stuff like this is that where we released all of that, it wants to stick.
Okay.
Right? And so all you have to do to prevent that is move the finger. So a couple of times a day, make sure you get that guy to come all the way down and go all the way straight. As long as that tendon is gliding, it can't get stuck.
Okay.
You don't have to do anything real crazy to it. Ice, elevation, Tylenol, ibuprofen typically takes care of it. Keep it up for a couple of days. There's no restrictions per se. You can do what you feel up to. Everything is structurally sound. It's just, you know, it'll be sore. You don't want to push it too hard.
Okay. All right, so ice, and I can get it wet. Just no submerge it.
And we got that. We're gonna print up that we can give to you as well.
Keep this on for about a day and a half.
Yeah.
All right.
There
So
you
I'm
go.
going to turn this off now. Thank you.
You're welcome.